You're listening to 1330 AM KROT, Philadelphia. This is a breaking news update. Please stay tuned for the latest information.
It's 7:13 a.m. this Thursday, October 13th, and I'm Chris Kennedy to bring you the latest on the ongoing crisis in the city of Philadelphia. It appears as though other cities around the nation are following what is now being referred to as the Philadelphia Plan in regard to containing the novel illness that has been afflicting people across the country. This plan involves containing all infected people to one regional hospital in order to prevent a shutdown of medical services to the surrounding areas, as well as preventing potential cross-infection between those afflicted with this new illness and those who are still symptom-free. The number of infected has risen rapidly since initial reports of the illness first broke. There are now over 100,000 cases across the country of this new illness, including over 2,900 cases in the Philadelphia area. Following rapid deployment of the Pennsylvania National Guard and the United States Army Medical Corps, all patients infected with this novel illness were transported to St. John's this past Tuesday. Patient conditions appear to have worsened, and as of 2:47 this morning, the first reported death due to this illness was confirmed. According to on-the-scene sources, this was quickly followed by another 8 deaths, after which some surprising measures were taken. These measures included a total lockdown of the hospital and armed soldiers forcing reporters and news crews to leave the area. Officials monitoring the situation have declined to comment on why exactly these measures were taken, but urged the public to remain calm. However, city officials are struggling to maintain order as citizens take to the streets. A large group that organized outside of City Hall to demand answers was met with riot police, who arrested several dozen of the protesters. Despite not providing answers as to why these measures were taken, the CDC has released an official statement informing the public that of the 9 reported deaths in the Philadelphia area, several of these patients had been infected with the illness for weeks and others had only been infected for a day. While not a definitive case study, the CDC declared that this small sample size does show that this disease affects people differently. The CDC encourages everyone to seek immediate medical attention if they suspect that they have symptoms. Health officials also warn the public to stay in their homes and to avoid contact with anyone who may be infected. They also urge anyone currently protesting to return home. In spite of these warnings, many residents of Philadelphia have taken to the streets demanding answers. Some involved with the protests have claimed that they have been barred from visiting or even calling family members who are afflicted with this disease. In response to the rioting, city officials have declared a curfew. Residents are permitted to leave their homes between the hours of 6 a.m. and 7 p.m. for essential tasks. These tasks include going to work, grocery shopping, and seeking medical attention. All residents who leave their homes outside of this time frame will be subject to interrogation by police. All residents caught participating in protests and riots will be subject to immediate arrest and potentially deprived of their right to counsel, based on the nature of their involvement with the riots. The mayor's office also put out a formal request for federal intervention should the situation worsen. Critics accuse the mayor of attempting to provoke martial law. Elsewhere, communities around the city have begun to start their own food pantries. Fearing that processed foods could contain the contaminants that cause the outbreak of this novel illness, people are getting together to gather fresh fruits, vegetables, meat, and water. Many residents have begun to pool their money to purchase food from local farms, and some have begun the process of driving to Amish settlements to set up supply chains of food. This has caused neighboring counties to begin blockading roads leading in and out of Philadelphia County, fearing that Philadelphia residents will inadvertently spread this new disease. In a recent press conference, the Bucks County District Attorney's Office has sworn to prosecute anyone from Philadelphia who enters Bucks County and tests positive for this disease. They're claiming that they will charge anyone caught in this way with a litany of charges, including but not limited to bioterrorism. When pressed about whether such charges would be an extreme measure, a representative of the Bucks County District Attorney's Office stated the following.
We have precedent for our actions. Recently, the United States 5th District Court of Appeals affirmed such charges against someone who claimed to have paid someone infected with COVID-19 to lick everything in a supermarket. We see little difference between carrying a biohazardous disease in a sealed container, paying someone infected with a biohazardous disease to spread it, and carrying a biohazardous disease in your own body to spread to other people. We are warning everyone who is presently infected with this illness to stay out of Bucks County for your own safety. We won't hesitate to prosecute you to the fullest extent of the law.
With the present situation growing more dire, we here at 1330 AM KROT promise to keep everyone in Philadelphia and surrounding areas informed of all important updates. We need to air some commercials, but coming up after the break, we have a report about the best ways to avoid contracting this new illness when you have to go outside. This is Chris Kennedy telling all of you to stay safe.